Chris from DrugAware, a website dedicated to helping people overcome trouble with drug abuse. Here's his views on the subject. Okay, Chris, thank you for joining us. I'm going to start by asking you, why are so many young people turning to drugs?
There are a lot of different reasons why young people turn to drugs. There's peer pressure, there's various other different social factors and wanting to fit in. Sometimes it can be down to a simpler thing as boredom. There was a recent study carried out by that was actually published on the Home Office website saying that 46% of young people who abused drugs would actually turn to sport and leisure activities if they had them available.
And there are many misconceptions about what drugs do to the body and what effect they can have. What can be done to educate young people on the dangers of drugs?
I think a lot more can be done than is already being done. I think drug education being done even earlier than it is probably a good idea. A recent survey in Scotland of 23,000 school children showed that more than 27% of just 15-year-olds had already used illegal drugs. 9% of 13-year-olds had. So tackling drug education at an earlier age and perhaps having even more of it is probably a good idea. And more general information on the potential harmful side effects, such as mental illness with heavy cannabis use, again, needs to be publicised more, because people have a perception that cannabis is a relatively safe drug, but in terms of mental illness, it is a significant problem.
Many over-the-counter drugs are also recreationally used. What are some of the dangers associated with this type of drug abuse?
A number of different dangers are out there. Of course, as you rightly say, there are different ways that over-the-counter medications and prescription medications can be abused. One of the major substances that's abused are actually volatile substances, such as things like glue sniffing or solvent abuse. And actually, that can kill more children and more young people than a lot of the other illegal drugs put together. Sudden death syndrome from solvent abuse is a very real problem, and it's one of the more common substances after, say, cannabis use that's out there.
Do you think that legalising drugs help remove some of the curiosity in them and possibly stem the urge for teenagers to experiment with them?
I think any kind of move to make these drugs more acceptable or more widely used and so on is probably a step in the wrong direction. If you look at, say, Holland, when they legalised cannabis use in certain licensed cafe premises, the amount of cannabis that was used has massively increased than it was before, and also so now has the amount of mental illness in the community. So again, they found that heavy long-term cannabis use is helping to bring out any kind of mental health issues that people might already have had, but they weren't actually manifesting. So anything that encourages people to use drugs is probably a bad idea, because one drug tends to move on to the next. Over 80% of people who use drugs tend to use more than one drug. So if you're looking at the possibility of starting on a lighter drug, the chances are that people will also then move on to harder drugs, such as Class A drugs like ecstasy.
Okay, and what advice would you give to a teenager dealing with peer pressure and thinking about experimenting with drugs?
There's bound to be a lot of pressure for young people with regard to taking drugs or using substances. But the fact is, there are many other ways to have enjoyable social time without needing to resort to drugs. There was a survey that was carried out and published on the Home Office site showing that 46% of young people would rather have sporting activities than use substances if they had that option. So finding other activities is always a good idea. But also, there is some movement now towards parents having home drug testing kits, and so quite often teenagers can say to their friends, well, I can't use illegal drugs because I get tested at home, and that then tends to remove that social pressure, because people are aware that it's not because they're square or whatever you want to call it that they're not using the drugs, it's because there are potential penalties about being detected. So having something like that often does aid with removing that peer pressure.
What exactly are home drug testing kits, and where would parents be able to find information about them?
Home drug testing kits can be found on the internet. We have a website, www.drug-aware.com, and there's information on how you can source drug testing kits and a lot of frequently asked questions about them. Now, testing kits tend to be provided by mail order because of the there isn't sort of a mainstream sort of supply of kits. You couldn't just necessarily go to Boots, for example, and buy a test kit, but they work on a very similar principle to something like a pregnancy test, but then have all of these supported telephone lines so that parents can get more information about the whole issue. And quite often this is more to be used as a deterrent or to rebuild trust in a relationship if that's been damaged.
And what support is out there for people who have drug problems?
There are a number of different places young people can contact, or even parents worried about their sons or daughters. One of the main ones is talktofrank.com, and they also have a telephone number on their website that you can call 24 hours a day. It's a free phone number and can put you in touch with any of the help that's available within your community to deal with the problem or to talk it over on the telephone.
Okay, thank you, Chris, for joining us, and good luck with your campaign.
If you want to hear more on the subject, or if you need help or advice with drugs, you can visit their website at www.drug-aware.com or call them at 01332 232 820.